It's got the power. This time I'd like to call the Nash Board of Education meeting to order. And we will start with the swearing in of new Board of Education member, Ms. Rhonda Bullock. Ms. Sumner, thank you so much for coming tonight.
Mr. Lamb, it's always a pleasure to be here with you. Dr. Ellis, my friend, how are you, sir?
Good to see you.
What about me?
Good to see you.
Good to see you.
Always.
What about me?
Always. Yes, sir.
Nice to meet you.
Ms. Lamb, do we have a Bible somewhere? No. Got one sitting on my desk. There's one on my desk.
Yeah.
We know. I'll be loud.
Turn towards your husband. Right hand up.
Left hand.
Raise your right. Raise the right. And let the young man. That's good. That way we see everybody. Okay. Do you solemnly swear that you will support and maintain the Constitution and laws of the United States, and the Constitution and laws of the state of North Carolina, not inconsistent therewith, that you will faithfully discharge the duties of your office as a member of the National Board of Education? So help you God. Congratulations. I'll bump you this way, okay? You're good, Dr. Ellis. You're good. Looking right in front of you. And just for 1 second, just take the mask off quickly, and we'll do this not to hold up their top. Here we go, guys. Congratulations. 1, 2. Thank you.
Thank you. Well, congratulations. Look forward to meeting you when we get out of here. Good to see you. Take care. Thank you again, Judge Sumner. I can certainly leave. No, the good lady. Gosh.
Wait, wait, sit.
Ms. Bullock, we're extremely happy that you can join us tonight. Like I said at the last meeting, you know you got big shoes to fill, but I'm sure you can handle it. Glad to have you part of our school board. At this time, would everybody please stand for the Pledge of Allegiance? I pledge allegiance
To the flag
to the United
of the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We need to, before we adopt the agenda, make a addition to the agenda. Number 12 on the back of the copy of the agenda will go back into closed session, and number 13 will be the adjournment. At this time, I will entertain a motion to adopt the agenda as amended. Motion by Mr. Sharp, second by Mr. Bizzett. Go through the roll call for approval. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
yes. Mr. Bizzett, Mr. Sharp,
Yes.
Mr. Dunton,
Yes.
Mr. Jenkins,
Yes.
Mr. Silver, Ms. Washington,
Yes.
Ms. Bullock,
Yeah.
Bullock. Ms.
Yes. You can call me Heinz Bullock. That will be fine.
I'm just gonna go, I'm gonna go with E and S right now.
Whatever you prefer, Mr. Chair.
Motion carried. I will entertain a motion to approve the board minutes.
So moved.
Motion by Mr. Sharp,
Second.
second by Ms. Washington. Ms. Chavis,
Yes, Chavis.
Mr. Edwards,
Yes.
yes. Mr. Bizzett,
Yes.
Mr. Sharp,
Yes.
Mr. Dunton,
Yes.
Mr. Jenkins,
Yes.
Mr. Silver,
Yes.
Ms. Washington,
Yes.
Ms. Hines Bullock,
Yes. Thank you.
Ms. S. Bullock. Motion carried. Down to recognitions, Dr. Catalano.
Good evening, Chair Lamb, Vice Chair Washington, and members of the board. I am here with you tonight with a set of recognitions from the Rocky Mount Telegram's Reader's Choice Awards. We would like to congratulate the following Nash County Public School teachers for winning the Rocky Mount Telegram's Reader's Choice Awards for Best Teacher. Our bronze winner was Jessica Powell from Nashville Elementary School. A silver winner was Betsy Hester, former Rocky Mount High School teacher. Our gold winner was Garrett Sheeran, again from Nashville Elementary School. We had two of our Nash County principals that won the Reader's Choice Award this year. So congratulations to John Milner Williams from Parker Middle School as the best middle school principal, and Quentin Magano from Nashville Elementary. A big congratulations to all of the Rocky Mount Telegram Reader's Choice Award winners. And that concludes our recognitions for this evening.
Thank you, ma'am. Public input, we do not have any tonight. That brings us down to business items, communication, planning, and engagement. Dr. Catalano.
Yes, I am here before you tonight with one donation. Please accept the request for the following donation from Bailey Elementary School. They received a donation from Bailey Police Department with an amount of $2,501 to be used for general funds.
Thank you, Dr. Catalano. I will entertain a motion to approve the donations.
Mr. Chair, I move that we accept the donations with great appreciation.
Second.
Motion by Ms. Chavis, second by Ms. Washington. Ms. Chavis,
Aye, yes.
Mr. Edwards?
Yes.
Yes. Mr. Busy?
Yes.
Mr. Sharp?
Yes.
Mr. Dunn?
Yes.
Mr. Jenkins? Yes. Mr. Silver?
yes,
Ms. Washington?
Yes.
Hines Bullock?
Yes.
Ms. S. Bullock? Motion passed. Policy proposals, first read, final approval. Dr. Catalano.
Good evening, Chair Lamb, Vice Chair Washington, and members of the board. The Nash Board of Education Policy Committee approved several recommendations. The first to rescind 2 school board policies. These are policies that, with the 6 new policies that we have on the agenda, will be replaced with the new policies. So rescind 2 policies. They request that you approve 6 new policies and 5 revised policies. These policies are related to a Title IX change, and they are from the School Board Association. All except one of the policies are from the School Board Association in alignment with that Title IX regulation change.
I'll entertain a motion to approve the first read.
Um,
and final approval.
I apologize. I actually, so the policy committee recommends the acceptance of the policies for approval and that the 30 days be waived due to the fact that the regulations are, have taken effect in September. And that would bring our board policies in alignment with the federal regulation.
May I ask a question?
Yes,
Yes,
ma'am.
Chris, did we say all of these policies or just policy 4700? The 30-day period be waived.
We said all of them because the Title IX regulation is in effect currently right now. And the other policies will bring us our policies in alignment with those Title IX regulations.
Okay, thank you. I
ma'am.
will make that motion, Mr. Chair, that we approve the policies that are listed and waive the 30 days.
Second,
Motion by Ms. Bullock, second by Ms. Chavis. All in favor, Ms. Chavis?
aye, yes.
Excuse me.
What do you say?
Say it.
Yes. Can y'all hear me?
I think we lost sound.
She said yes.
Yes.
What-
I don't know why we lost sound.
The question was which one to be, which one to be ready for approval. Ron is trying to update his information.
Can you speak up, please? Seems like I'm forever asking
can
that.
you guys hear us?
Dr.
on Zoom?
Catalano,
Yeah.
right there.
If you can hear us, raise your hand.
So now, repeat your question again.
I don't have a microphone. I don't want to share your microphone. I'll let you do the talking.
So was there a question?
Mr. Malone has a question.
Ms. Bullock has a question about which one, excuse me, Rod Malone has a question about which ones were actually rescinded.
Okay, yes. So we had policy, let me look through my list here. 1710
and
and
17.
1720. I'm sorry.
You good, Rob?
You got that, Mr. Malone?
Correct.
So they are listed in Simbly, and they're labeled old version rescinded. It was 1710, prohibition against discrimination, harassment, and bullying. And then we had 1720, The old policy that is being rescinded was discrimination, harassment, and bullying complaint procedures. Both of those policies were replaced with new policies and renamed.
Rescinding and approving the final. One motion for two of. All right, we have a motion, we had a second, we're in the voting now. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
yes, Mr. Bizzett, Mr. Sharp, Mr. Dunn, Mr. Jenkins,
Yes.
Mr. Silver,
Yes.
Ms. Washington,
Yes.
Ms. H. Bullock,
Yes.
Ms. S. Bullock. Motion carried.
Oh, God.
Human Resources, Ms. Privet.
Mr. Chair, we did have another agenda
I'm
item
sorry.
for policies.
Final approval. Go ahead.
Correct.
I'm sorry.
That's all right. So we have a number of policies that were approved in actually the July meeting, and are up for final approval tonight. The Nash Board of Education Policy Committee recommends the acceptance of these policies
For final.
for final approval. Yes, I'm sorry.
I make that motion.
Motion by Ms. Bullock. I have a second. Second by Mr. Silver. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
yes, Mr. Busy, Mr. Sharp, Mr. Dunn, Mr. Jenkins,
Yes.
Mr. Silver,
Yes.
Ms. Washington,
Yes.
Ms. H. Bullock,
Yes.
Ms. S. Bullock. Motion carried. Now, Human Resources, Ms. Privet.
Good evening, Chairman Lamb, Madam Vice Chair, Dr. Ellis, and members of the board. I request your approval of the Personnel Recommendations Action Report presented tonight in closed session.
I will entertain a motion to approve. Motion by Mr. Sharp. Second. Second by Mr. Silver. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
yes, Mr. Busy,
Yes.
Mr. Sharp,
Yes.
Mr. Dunn, Mr. Jenkins,
Yes.
Mr. Silver,
Yes.
Ms. Washington,
Yes.
Ms. H. Bullock,
Yes.
Ms. S. Bullock. Motion carried. Personnel recommendations for information, Ms. Privet.
Good evening again. Our personnel information report requires no board action. It's for information only.
Thank you. Student Services, Mr. Farrow.
Can you all hear me?
Yeah.
Yes.
Now, yes.
Good evening, Chairman Lamb, Vice Chair Washington, Superintendent Dr. Ellis, and members of the board. The superintendent and his cabinet come before you tonight to present information for information only, the Nash County Public Schools Strong Reopening Plan Update. And we're going to start with Dr. Catalano.
Actually, I believe that we have Sheila Wallace with the 21st Century After School Services contract before the
Yes, Ms.
presentation.
Wallace.
Good evening, board members.
Good evening.
Good evening.
On behalf of Dr. Ellis, our superintendent, I would like to present to you all the contract for approval for the 21st Century After School Program. This contract is made in partnership with the Boys and Girls Club of the Tar River Region. This contract will be the last year of this program, and it serves students in after-school programs on the southern end of the county. There are 5 schools that are covered underneath this program. That is Bailey Elementary, Middlesex Elementary, Cedar Grove Elementary, Spring Hope Elementary, and Southern Nash Middle School. This contract is presented for approval for the amount of $135,000. Are there any questions?
Sure.
Are these services provided at the schools or where they're provided at?
Yes, sir. They are provided at the schools, but during the remote learning plan, this program has not begun yet.
Mr. Jenkins.
Is this the same contract as any changes or anything from last year? And is it the same amount of money being spent?
Yes, sir. It's the same contract from last year. This contract was in effect for 3 years, and money has reduced because we have reduced the amount of money that we've received from the federal government.
Thank you.
Funding source?
21st Century Grant, which is a federal grant.
Thank you.
Any other questions? I will entertain a motion to approve the 21st Century After School Services Contract.
So moved.
So
I got a
moved.
question.
Motion by Mr. Sharp, second by Ms. Bullock, Ms. H. Bullock. We will vote Ms. Chavis,
Yes.
Mr. Edwards.
Yes.
Yes, Mr. Visit. Mr. Sharp,
Yes.
Mr. Dunton, Mr. Jenkins,
Yes.
Mr. Silver,
Yes, sir.
Ms. Washington,
Yes.
Ms. H. Bullock,
Yes.
Ms. S. Bullock. Motion carried. Thank you, Ms. Wallace. Reopening plan update for information only, Mr. Farrow.
Mr. Farrow, before you start, I'm just going to do a brief of what we're trying to do, if that's fine. I just want to make sure that what we want to show tonight is where we're at. We did the 20 days. We did the virtual Plan C. We talked about at the end of the 20 days, we were going to decide based on metrics, teachers, staff, parents, how they felt. And that's what Mr. Farrow is going to start tonight. So at the end of this, there'll be a recommendation that we want you to decide whether we move forward based on our plan starting in August, okay?
Thank you, Dr. Ellis. So I'm going to try this again. Good evening, Chairman Lamb, Vice Chair Washington, Superintendent Ellis, and other members of the board. The superintendent and his cabinets coming before you tonight to present information on the Nash County Public Schools Strong Reopening Plan and Update. We're going to begin with community engagement. Dr. Catalano will start us off with this particular section.
Good evening. I just have some updates for you on some community engagement efforts that have been ongoing. We have a wonderful opportunity. Pam Gould and Jane Finch with STEP have gone out into the community and found businesses. We have actually 17 businesses currently who have internet access in their place of business and have identified a location in their offices where they will allow some Nash County students to go if they don't have internet at home. And so we're very happy to have this opportunity open for our students through our partnership with STEP. We also have identified 3 of our schools that have internet access quite a distance out in their parking lots. And so we will be opening up drive-up Wi-Fi services at Nash Central High School, at Northern Nash High School, and at Rocky Mount High School. And there are between 20 and 30 spaces at those in parking lots at those schools where families and students will be able to sign up to drive up and use the internet for short periods of time, so that if they don't have a good connection at home, they can still use the excellent connection that we have at our schools. We also have had a lot of technology questions and a lot of troubleshooting that I know Tremaine's going to talk a little bit about with you about tonight, but he and Danny Plyler will be hosting a second virtual community information session on Tuesday. And that session will be solely about technology troubleshooting, and they will begin that session with some demonstrations about how parents and students can troubleshoot some common technology problems that we've seen across the district. And then we'll open it up just like we did the last session for some question and answer live on the YouTube Live platform. And finally, we have begun our district advisory council meetings for the 2020-21 school year beginning in September. So we have scheduled our parent, teacher, school administrator advisory councils and are in the process of finalizing dates for our community advisory council. And our plan is to add students to the mix in October with an advisory council representative of the schools across the district for students as well.
And as it relates to technology, the first couple of days of school has been very interesting, I must say. We've encountered many unexpected occurrences, from internet outages to keeping the morale of our staff and hoping that they don't quit from the added pressures of this COVID season. So if you look at the screen, we successfully deployed 3,222 hotspots to our students. And we are using both T-Mobile, which we pay for 12 months of service for unlimited data. And we also have Sprint 1 Million, which is a partnered program that they give us Wi-Fi boxes for free for our students. And those devices are active and they're available indefinitely for those students. To date, we have deployed 11,604 devices throughout our district. And this does not include staff. This is mainly our students. And I think this is remarkable at this percentage that we're able to provide such a high number of one-to-one devices to our students. Moving on to our, staying there with our laptops, we also have reported earlier that we have purchased devices for our pre-K through our 4th grade students. However, those devices have not come yet. We all are aware that every school district in every state has purchased all of the devices, and there are really none on the shelves. So we are expecting those devices. We were expecting them the mid this month. But I'm getting reports that we may be expecting those devices in October. So I'm hopeful that they'll come very soon. Moving on to our support calls, that number you see here is only a week. We started August 17th through the 21st, 1,025 calls, and that is an average of 205 calls per day. So with this information, what we had to do was beef up our support line. We have about 14 technicians for our entire district that covers over 32 sites. That's 29 schools and 32 sites, over 900 teachers and so forth and so on. So we had to beef up our support line. So we were able to partner with our bus garage, and they gave us some people to help us with our live support, because a lot of the parents that were calling, they wanted to hear live voices and live help. So we were gracious enough to have the bus garage to help us out and to loan us some bus monitors to answer the phones. If you look at our support tickets, again, this is only 2 weeks of support tickets. I started the 10th, August 10th through the 21st, and this is only 2 weeks of support tickets. And again, we have 14 technicians that service our entire district, over 15, right at 15,000 kids. So I just want to put this this out here so you guys know kind of what our metrics and what we're dealing with. And that's it for me.
Mr. Chair, may I ask a question, please?
I have one too.
Yes.
I want to ask this question to Ms. Catalano, Dr. Catalano. You mentioned about the hotspots on the school premises. What are the hours for that, and how's that being secured, and how's that being monitored?
Right. So we have worked with the transportation department. Mr. Litke has bus drivers and monitors who do not have employment currently because we're not transporting students. And so we have a rotating schedule where they'll be on those campuses to monitor the parking lots periodically as the day moves on. The sites will be open from 8 to 3. So they'll be open during the hours that we have student resource officers on campus. One of the reasons, outside of the fact that those high schools had pretty strong connections out into their parking lots, but one of the reasons we chose to keep this to the high schools was because of the fact that they did have SRO officers on campus. And I've met with the principals at those schools, and we've identified the parking lot based on the whether or not the camera system that all of the schools have will capture the parking spaces as well. So we've got kind of a triple layer of monitoring there. And as families call to sign up, we actually have had a couple call to sign up, and we're sharing with them that the rule is that they're there for a 2-hour time slot, and that they must remain in the car. So there can't be any congregating or anything like that while they're there to use the internet.
Gotcha. Question 2. Were we able to find some way to connect with churches? I had several pastors to call me and wanted to offer their church fellowship halls as a way of offering internet for our students. Were we able to do anything with churches?
Absolutely. So those 17 sites that STEP has reached out to, I would say the great majority of them are churches, and they are in many areas across the county. We've got a church in Momire, we've got several in Rocky Mount, Nashville, and just today I've had 2 more that have called and let us know that they're interested as well. And we have we're going to be using transportation staff at those sites as well, so that we can monitor that is too, and make sure that social distancing is maintained and all of that. We're going to keep the numbers down at those sites, so there's just a very small number, and they're also going to be rotating in and out as well. So we hope this will help some of our families that either just don't have a strong enough internet connection at home to participate in some of the remote learning, or that don't have any internet at all. It will at least give them some opportunity. And many of them are churches, yes.
Mr. Chair, I have a question.
But will you reach back and thank STEP for helping us to be a partner and making sure that this is done, and thank them for that, please, for us?
Absolutely, absolutely. I was actually considering some recognitions of them as well as we move into this. Yep. I
have a question, Mr. Chair. First of all, I would like to applaud the genius that thought of this idea. It's awesome because I know as one board member, I've gotten lots of calls regarding the signal strength, especially out in the area that I am in. So this is commendable. What is the process, and how are we advertising to our parents how to sign up for the Drive Up internet?
Right. So we have put it out on social media. All of the principals have access to the information, and they have been sharing it with families as they call in. And the social workers and the teachers are reaching out to students who they know are struggling a bit. Many of the calls actually that we've gotten, which we haven't gotten a lot, but we're hoping that it picks up. But many of the calls actually came from a teacher picking up the phone and calling the the parents and saying, look, this is a great opportunity for you if you'd like to. And we've got a phone line that's dedicated so that they can call that number, and it'll ring in the 3 communications offices, and so we can get people signed up quickly. Also, I met with Ms. Royster today, and she's been out in the community talking with families as well at Williford Family Resource Center. And so she's going to be helping out with signing families up and getting the word out there. So we will also be sending a Connect Ed message out before the end of the week. So
That's awesome.
Okay, this is Angie Miller, and I'm going to talk with you a moment about the meal services. We got some great news on Monday afternoon last week. At that point, we had got a plan in place because students were going to have to go back to their status, meaning their application status, and other than our CEP schools, they would have had to pay. But the USDA, and I think you guys got that information, the USDA was able to give us a grant, the summer program will continue, and we will be feeding all students in our communities and schools from now until December 31st. So that was outstanding news. You'll see here that I've listed a lot of schools, their times. As we continue to move forward in a plan B or C, they will be serving as a drive-through service as well as meeting the needs of any of the students that get phased in at any point. And we're going to continue to phase in our schools till we get them all. We got this week, a few more next week, and there's only a few, only because of technical issues with the transportation. They're being so close together. For example, Red Oak Elementary and Red Oak Middle. Right now we're using Red Oak Middle because we can't filter cars through quite as easily, just like Parker and Baskerville. But we're going to continue, and all the employees of ours that are willing to work are working, and we have all sites running smoothly. Thank you.
PPE equipment has been delivered or is being delivered to the schools. We still have a few items that have been on back order. They're starting to come in now, but most of the items have been delivered to the schools. Custodians are conducting daily enhanced cleaning of high traffic areas, and starting September 9th, there will be an enhanced cleaning day every Wednesday for the foreseeable future. As far as cost of sanitizing and PPE supplies, items that have been bought through my office, and you can see a list of all of these items, have either been funded through the state grant, which started in March and ran through June 30th, or either the CARES Act, which is currently being funded. You can see all of the costs that have added up here. The scanners is an item that we're really proud of. We have one at every campus. I think we'd like five of these that'll be set up, and every campus will have these. This is for the temperature checks to help increase the speed of that. All of the other items you see here, most of these are on hand, all but maybe a couple of the items. I know clear mask for instruction, but most of everything we have has been delivered to the campus.
I have a question.
Ms. Chambers?
Scanners for all the schools, does that include our college, early college?
Yes, it does.
Shannon, can I ask you a question as well?
Sure.
Can we go back to the previous slide? What is the difference in the daily enhanced cleaning and the enhanced cleaning that we do on Wednesdays?
Excellent question, Ms. Bullock. The biggest thing is the chemical that we're using, the Virex, has a 10-minute activation time to give you 100%. So what we're doing the other days is we can't put this chemical on door handles and everything and let it sit the full 10 minutes to get the full effect. What we want to do on Wednesdays is go through and spray all of these items, these desks, these high impact areas, let it sit and then come back and wipe it off so that we get the full effect, as well as doing the hallways and other areas that we can't do while we have a lot of staff moving in the building.
How long does it sit?
So is the effect for what we do on Monday, Tuesday, Thursday, Friday enough protection for our staff?
What we're doing Monday, Tuesday, Thursday, Friday is the best that we can do without creating an additional hazard. So yes, what we are doing, we're not saying that what we're doing is not working. What we're saying is on Wednesdays, we're giving it the full 100% effect of cleaning the campus.
I got that, but I want you to assure me that even though it sounds like we're doing minimal cleaning on the days other than Wednesday, and I need assurance that on those other days, I don't have to be worried that we are skipping a step or that the protection, the level of protection that our people need is lacking.
Right. I fully understand what you're saying, Ms. Bullock, but what I can assure you is we're giving them the best protection that we can give them without creating additional hazards.
But is it enough?
I think that is a $1 million question. And I think most school systems and other business are probably dealing with the same situations we're dealing with.
All right, I'll leave that alone for now.
Shannon, on the cost of materials that you said that we've got in the schools now, how much of that is reoccurring, and do we have enough budget to successfully cover that for how long a period of time?
Mr. Lamb, the biggest issue we're dealing with right now, we have of the hand sanitizer, we have quite a bit we have not issued out to the campuses. We still have it in the office. That will be the biggest issue, along with paper towels and other supplies. Once we roll into the plan B, when we're really bringing kids back on campus, naturally your hand sanitizer, disposable face masks, some of those items will start being used up rather quickly. I will tell you, I have 5 pallets of the 1 gallon hand sanitizer that is at my office that we will be distributing as schools need them. But the longer we're in this B plan, of course, you know, you can see the cost we have of the hand sanitizer. We will have to have some more funding to continue this the longer we're in this B plan.
I think it's good for our public to see how much we are trying to prepare to make sure we are as safely operating as possible, and how much is being spent to make sure this process is continuing on.
Mr. Chair, I have a question.
Mr. Elwood?
Shannon,
Yes.
what's your estimate of the figure that you were just talking about as far as spending in the future?
Well, you can see the scanners, of course, is a one-time expenditure, and that expenditure can be used, you know, post-COVID, also for flu season. So that expenditure is probably the largest one you see. The next biggest thing we're going to have to be purchasing is this hand sanitizer, possibly more disposable masks. We've got clear masks for teachers, but the biggest thing will be the sanitizing products themselves, the paper towel cost. You know, they're going to be a lot more cleaning, so you're going to use a lot more paper products. Those are costs that I would say, depending upon the length, once we get into a B, I will be able to kind of see and place orders further out as I see how much is being used once we start these plans. But to give you an exact figure at this point until we start really utilizing these products, it's hard for me to give you an exact figure because we have staff on campuses right now with no kids. So we're not really using a lot of the product.
Mr. Sharp?
Mr. Davis, good evening. How are you?
Good.
Question for you. I'm looking at these ozone machine, $19,000. How many of those?
We got 25.
Okay, could you share with the board the purpose of the ozone machine, please?
We bought those, and I know there's some discrepancies out there on whether or not ozone machines are effective or not effective. I've done a lot of research on them, which side of the fence you want to talk upon, but we've used ozone machines as long as I've been with the district for all sorts of issues, from mold, mildew, and things environmental. It's proven that if you research, it has killed a lot of viruses. Of course, you can go online and Google, but ozone machine basically depletes the oxygen in the room. And we run these things overnight in classrooms. And to tell you that they're 100% for COVID, but it's an added protection that we do use because we use ozone machines for a lot of different reasons.
Mr. Sharp, I would like to chip in on what Mr. Davis is saying from the hospitality and hotel industry. They are very valuable. They're not 100%, but it does give you an edge that's worth its cost.
My question is not concerned about the valuability of it. I just want to make sure we understand the purpose of that. And once you utilize that piece of equipment, that location is shut down for a certain time frame. So if we have a case, when you utilize that situation or that piece of equipment, do we have enough? If we have an outbreak, I'm saying, not saying we're gonna, to actually go throughout the district?
That's an excellent question. And 25, I mean, we can do an average classroom overnight with one. So that's 750 to 900 square foot classroom. We feel comfortable that we can get the levels high enough to kill basically anything in that room. It has a 10 to 15 minute air out time once we pull the machine and shut it off before you can enter the building or enter that classroom. We don't have to close an entire wing down. We can isolate classrooms.
Any other questions from Mr. Davis? Thank you.
I'll share with you tonight our athletics update. As we begin to phase students in for the academic piece, we will also be phasing them in athletically. At this time, every other week, we're meeting with athletic directors and getting our plans in place. We don't want to start something that we can't finish. So we have been very forthcoming in plans to meet all the High School Athletic Association guidelines as well as DPI guidelines for middle and high. And we feel very confident that we'll be able to, once students start to phase in, we'll be phasing in some of our workouts in the afternoons.
Any questions from Ms. Miller?
Could you talk a little bit, phasing in workouts in the afternoon? So what are we talking about size-wise, number of kids on campus?
Good question, Mr. Sharp. Those guidelines are met by the High School Athletic Association, and that'll depend on the governor's rules. At this time, we have a small group of 10 to 25, and they'll be rotating in. So our triathletes will get the opportunity to work out with various different coaches, and there'll be a pod set up so that we know who is there. They will all be checked in again after school, just like they are during school hours, temperature checks. They'll go through the whole process. They will be wearing masks when they are not working out, when they are on the sidelines. Coaches and everybody will be following the same guidelines for the governor. They will be outdoors, and they are giving us updates weekly. At this time, we have not started because many of the other districts that have started and across the state, they keep changing the guidelines quite frequently, and we don't want to start something that we can't finish. So we're meeting every 2 weeks just to make sure that we have all of our stuff in place so that when we get ready to start, I will give you a complete update on the numbers and how it's going to look at the various schools.
Any other questions from Ms. Miller? Thank you.
Good afternoon again. want to share some information with you about symptom screenings for staff and visitors that are taking place at our schools and auxiliary buildings, including central office. Daily, we go through temperature checks. We're using handheld infrared thermometers, the body scanning metal detectors that Mr. Davis just spoke with you about. There's 3 screening questions. Some of those questions have some follow-up questions to ensure that if we're having to exclude a staff member or a person from the campus, that we're doing so with integrity. There are hand sanitizer stations that are set up throughout our buildings, throughout our school buildings, throughout our office, not office spaces, excuse me, our auxiliary buildings, excuse me. There's a contact tracing protocol that's in place. If it's someone on a school campus or within one of our auxiliary buildings have been in contact with someone who has COVID-19 or test positive for COVID-19, our school nurses help lead that process along with the school principal, the responsible person for that particular building. Face coverings, it is mandatory that individuals wear a mask when they are in gathering areas. If they're in a classroom or in an office space that's by themselves, it's not necessary to wear a mask, but when they're in the presence of others, they should be wearing masks, excuse me, they should be 6 feet apart. We have face shields for some of our staff who are doing screenings, who will be working in the isolation rooms and who will be working in self-contained settings, and that includes our school nurses as well. Some of our K2 teachers and speech therapists, Mr. Davis, have purchased the face mask with the clear mouth area for those individual teachers so that it will help when they're trying to teach children language. If we have to send a staff member home in terms of managing those symptoms, again, that is done through our school nurse along with guidance from the health department. When we return to school with students, if we have a situation where a student was to test positive for COVID-19, the first thing we would do is we would reach out to the health department again. And one of the things, or the things that the health department are going to want to know is, were the students in the classroom wearing masks? Was there frequent cleaning happening within those classroom spaces? Were the students 6 feet apart? Did screening take place before students entered the building? Did the students remain in the same classroom? And if we can answer yes to those questions, for the most part, just that student will be sent home and the other students will be allowed to return to school. Now, all of this is going to be handled on a individual cases basis. And it's hard to nail it down and say that if this happens, then this will happen. If that happens, then that will happen. Because what the health department is going to look at is, did we use the safety measures in place that we had in place? Was it a classroom where children, like smaller children who may not be able to keep their face mask on the whole time, where they're pulling them down and putting them back up, or they're having a situation where it needs to come off? All of those things are going to come into play when the health department helps us make a decision about whether just that child needs to go home, whether that entire class needs to go home, or if an entire school building needs to be closed.
Good evening.
Hold on 1 second. Mr. Dunn has a question for Mr. Farrow.
Yes, sir.
Mr. Farrow, just a quick question. I know y'all have been having weekly, monthly conversations with the health department. What kind of guidance, what kind of instruction, how has that partnership been, and what kind of information are they providing to us to kind of help set some of those markers for how to handle these cases when they happen?
It's been a very good relationship with the health department, including UNC systems. But what the health department is telling us is, first of all, that we have to make sure that we're using the PPE, the personal protective equipment, that we need to be wearing face masks. We need to be sure that we're staying 6 feet apart. We need to ensure that we have a screening process in place. For instance, we had a situation at a school where a person was in contact with someone who had COVID-19. The individual doesn't know if they have COVID-19 at this time. They have received the test but have not received their results. But the health department is saying to us at this point, individuals, if they've come in contact with someone who has COVID-19, they do not need to rush out within a 1 to 3 day time period of coming in contact with someone and taking a test. Because what they have now found out is that the virus actually incubates within the body for a period of time. And if you go in too early and get a test, you're going to test negative. So what they're suggesting that we tell people to do is wait around the 6 or 7 day mark after coming in contact with someone. So then they will go and be tested. And that way, if they are positive, it will show up. So what this puts us in a place is that we have to tell individuals if they've come in direct contact with someone who has COVID-19, that you have to stay out for 14 days or until the period that you have went and been tested within that hopefully 6 to 7 day time frame. And then if your results come back negative, then you can come back to work. Now there are some, and there's levels in all of this. So if you can be in close contact with someone and you can be considered a high priority. You can be in close contact with someone and be medium. You can be in close contact and it can be low. And so those 3 different levels would also determine what happens. So that's why we make sure that we always involve our school nurse and we always involve the health department to make sure that we are giving people the most accurate information and what to do.
And Mr. Farrer, has the hospital been part of these discussions as well? And kind of what information have you been able to pull from them?
Yes, we've talked with the hospital as well. Mostly what the hospital has given us is information about some of the data, some of the trends, but really when it comes to the protection of the faculty, staff, the students within the building, they're really pushing us to lean heavily on the health department.
Thank you.
Yes, sir. Are there any other questions for me?
Good evening. Just 2 updates from Human Resources. We currently have 10 employees that are out on COVID leave, and they are eligible for COVID leave because no teleworking is available for them at this time, and they've been advised by a healthcare professional to self-quarantine. We have 57 employees that are teleworking, whether that's by way of accommodation or principal approval. And to be eligible for the telework accommodation, an employee has to be 65 or older, have an underlying health condition, cares for someone with an underlying health condition, or they are self-quarantining due to exposure to someone with COVID-19. Any questions?
I have a question, and I probably would want to ask this outside the public, but are these all the numbers you have? Do we have anybody hospitalized, or what are our standings in terms of positive accounts?
Mr. Farrow has the actual count of our employees that are positive, and to my knowledge at this time, we do not have any employees that are hospitalized.
That's correct, and that information is coming up on the screen later.
Okay, thank you.
You're welcome.
Mr. Jenkins?
How many of these are teachers?
I don't have that number in front of me right now, but just looking, just going through the list, I would say a little over half of these are teachers, and we also have teacher assistants for the remaining number.
Yeah. Any other questions? Thank you.
Good evening. The past 14 days have been have been an unprecedented opening for the school year for our students, parents, caregivers, teachers, and principals. Since August 17th through September 1st, believe it or not, we've had over 16,000 Zoom meetings or live classes. This is no small feat, and we want to celebrate this. During this section of the presentation, the student learning team will take you on a 20-day journey of what instruction and professional learning have looked like for our teachers and students. I would not be telling the truth if I shared with you that we have had all positive experiences. We've had quite a few hiccups, and we continue to learn several lessons every day along the way. But our parents and students have persevered. Each day, our teachers go back into the classroom and they're ready to face the digital challenges head on. Guess what? Our parents are sticking with it as well. Later in this presentation, Mr. Plyler will share with you our student engagement rates, along with our 10-day student enrollment. This week, I had a teacher to send me an email, and I would like to share this email with you. Our first 10 days of school have been unlike any other. Although the students aren't physically with us in the classrooms, I feel the sense of community is stronger than ever. Challenges have arisen, yet we have faced them head on with resilience and perseverance. In a world full of division, I am so grateful for the strong efforts of teachers and families working together in the betterment of our future generations. The unity is simply awe-inspiring. I believe that collectively, we can make this year a unique learning experience for all. I am thankful and very blessed to work for Nash County Public Schools. The best is yet to come. Garrett L. Sharon, kindergarten teacher at Nashville Elementary. Mr. Thompson.
So good evening. So tonight we wanted to share with you a timeline from where our teachers came in to actually next week, which would make our 20 days. So first of all, our teachers worked as they came in, they worked to prepare for remote instruction. August the 10th through the 14th, our teachers prepare for online learning through professional development. Teachers prepare for remote learning by engaging in PD that focused on the learning management systems, online core resources, and online instructional strategies. Also during August the 10th to 14th, we did have some orientations and open houses. Then if you move to the next segment, August the 17th through the 21st, which is actually our first week of school, teachers and students engaged in online classes to understand processes, procedures, and platform requirements. They continued orientations and open houses. And also videos were created for frequently asked questions on whether it was LMSs or instructional strategies. On to the second week, which August the 24th through the 28th, less time educating students and parents on digital tools and more time is being focused on direct instruction. Additional hotspots arrived to support access to online instruction and continued family supports for accessing digital tools. Also, our administration of the Case 21 gap assessments were completed or have begun and will be completed by September the 18th, excuse me. The week that we're in now, which is the third week of school, continuing to provide supports to teachers and families to ensure that their comfort levels are in a good place with online instruction. And we also are beginning the state assessment of iStation this week with kindergarten through 5th graders. Next week, we're looking at continuing these supports, also continuing with any new hires we have as far as with teachers, ensuring that families gain more access to internet if they do not have those. And as always, continuing to build supports for our teachers utilizing digital tools as needed. Mr. Plyler.
Good evening. I'm going to talk through our 10-day enrollments as well as Virtual Academy enrollments for our different grade spans. And in the process of that, talk about our student engagement within our learning management systems. In elementary school, our 10-day enrollment was 6,332. And our Virtual Academy enrollment was 2,447. And for those are students who have chosen to have the intent of not returning to school for in-person instruction when school reopens. They will have the opportunity during the week of September 21st through the 25th to opt out of the Virtual Academy when we choose to start back and school reopens. In our elementary schools, we have 2 learning management systems. The first is Seesaw, we use for our kindergarten through 2nd grade students. Right now, only our 2nd grade students have district issued devices. So our K-1 students are not being required to use the Seesaw learning management system. We have had some that have begun to use it on their own with personal devices or phones, but most of our kindergarten and 1st grade students receive packets for remote instruction from their schools. And the schools are still in the process of disaggregating the packet completion data. In the chart here, there are 2, and about Seesaw, there are 2 data points. The middle column shows the average number of students who has accessed Seesaw each week. And the last column shows how many made a post in the learning management system. In Seesaw, the students respond to activities and assignments that are given by their teachers by posting their responses. You can see the increase in both columns for week 1 and week 2. Week 2 saw almost a double the amount of posts as week 1, from 630 to 1,106. Keep in mind that these numbers are mainly our 2nd grade students, which make up about 1/3 of our student population in grades K2. So even though the percentages look smaller, that's fairly accurate if you consider the total number of students in those grade levels. Google Classroom is the learning management system that we've chosen for our 3rd through 5th grade students. The data we get from Google Classroom is more focused on teachers and classes at this point, and that bears itself out in the graph you see. The reporting is based on overall user access. This includes students, teachers, and also parents that access the learning management system. Since our students in grades 3 through 5 were given devices at the beginning of the school year, and their teachers had some familiarity with Google Classroom already, you can see that the numbers showed an increase from week 1 to week 2, but there was already strong usage from the beginning of school. In middle school, our 10-day enrollment numbers were 3,491, and those choosing the Virtual Academy were 1,344. Canvas is the learning management system the district has chosen for our students in grades 6 through 12. The early college has used Canvas for several years, and we purchased Canvas for middle school and high school at the beginning of last school year. Since there was some familiarity with Canvas from last year, you can see from the chart that usage of Canvas is strong. Good. We get usage data from Canvas based on a report that looks at the last user login date. These reports are run by term, and each school has at least 2 terms. We chose a single day during the 2nd week of school to see how many students logged into the learning management system on that date, and the chart shows that 2,948 students of 3,421 middle school students accessed the learning management system, which is again at 86.1%. Pretty strong usage for the 2nd week of school. In high school, our 10-day enrollment was 4,703. And of those students, 1,708 have requested to be part of the virtual academy. Again, Canvas is our LMS for high school, and we collected data the same for high school as we did middle school. And on that particular date, 3,893 of 4,610 students accessed the learning management system, or 84.4%. All of that data was based on the 10-day enrollment. And on this slide, you will see now what our current up-to-date enrollment is, the most current numbers that we have. In pre-K, we have 106, elementary, 6,361, middle school, 3,524, high school, 4,671, for a total of 14,662. And you see the numbers there for our no-shows within each grade span. And the last thing we wanted to show is to give you just a visual taste of the first 20 days of school. Here's a short video showing what instruction looked like in the district during the first 10 student days, and a peek at some unsung heroes who are making sure that our students get what they need and that our teachers are safe in their buildings.
So what we wanted to do now is look to the next 20 days. We had just talked through the first 20 days. So our next 20 days, we are looking at all teachers will work from their school sites as practical. We will continue with the weekly teleworking schedule district-wide. Revisit the remote learning plan and adjust instructional hours based on lessons learned from the first 20 days. Begin to communicate with students who will transition back to Plan B to the building. Also, the CNI virtual classroom visits so that we can help support teachers and principals in the schools. Assess iStation for elementary, case 21, and that will be K through 13. And the LMS data to inform instruction and where we need to move forward with instruction. And continue to provide professional development for online instruction, student engagement, and social and emotional learning throughout the district.
Part of our district's plan to reopen under Plan B involves bringing back our preschool and self-contained EC students. I have included in this presentation a link to the interim COVID-19 reopening policies for North Carolina pre-K programs. If you click on that image, it will take you to the entire document. However, this evening, I will share with you some highlights from this document. On August 3rd, we received the new preschool opening guidance from the Division of Child Development and Early Education. DCDEE serves as the governing body for all public and private NC pre-K classrooms. In this guidance, one section addresses the circumstances under which remote learning is permitted for preschool students. If a parent or family has requested remote learning due to the child or a household member being at high risk for severe illness during the due to COVID-19, they may request remote learning if a parent or guardian does not feel comfortable with their child returning for traditional in-person, face-to-face instruction. Also, the pre-K staff, if they request to telework due to their own health risk status, and also if the school district chooses to operate exclusively under Plan C with no exceptions for NC pre-K, and that is our current status. In this guidance, it also states that full remote learning is an option for pre-K through November 6th. This November 6th date is a tentative date. This option may be extended depending on COVID-19 metrics and any future state directives. Also, NC pre-K programs, enrollment has been low in NC pre-K programs across the state. So in understanding that, DCDEE has provided full payment for all of our contracted slots to help stabilize funding for programs. Typically, we are paid according to our student attendance, but for this 2020-2021 school year, we will receive full payment for all of our slots. Here we have all of our sites that we currently have pre-K, and these are the 7 sites where we have our traditional pre-K program. So the site is listed. Beside the site, you have the number of staff members at each site, then the number of students we currently have enrolled in preschool at each site. And the last column, that we have the number of students that we typically have enrolled at that site. Also, when we transition, if you'll go back, when we transition to Plan B, no class will have more than 9 students in attendance each day. NC pre-K, we have a 1-to-9 student teacher ratio. So to help with social distancing and cleaning and supervision, we'll keep the class size at 9 on any one day. So the highlighted sites on this slide, they may have to stagger students into cohorts A and B to meet that requirement. Also, teachers in their constant communication with parents have inquired about their preferred method of instruction once the district does decide to transition to Plan B. So on this slide, each site is listed. You have the number of students who are currently placed at that site, also the number of classes we have in preschool at that site. In the second column, that is the percent of families who have decided that they will return for face-to-face instruction when we reopen under Plan B. And in the third column, you have the percent of parents who have decided that their child will continue with remote learning when we transition to Plan B. Also, it's noted that when we transition to Plan B, the children's centers at Nash Central High School and Northern Nash, they will also open.
We included our students with disabilities in our initial Plan B, Plan C reopening presentations and discussions, but I did want to share with you similar data to what you just heard from the preschool, from Monique, about the preschool parents. The data shows a percentage of parents who prefer to have their children return to a face-to-face environment for learning versus remain in the virtual environment. So I've broken it down. This is our elementary percentage. When the teachers have called and talked with the parents or through the orientation process, asked the parents. For our whole elementary, we're at 80% of our parents who wish to prefer to have their children in a face-to-face environment versus 20% for the virtual environment. The next slide shows you from a secondary perspective, the exact same data broken down by our school by school data as well. And then the third slide with the data just shows you an overall percentage with our total district, and with 80% of our parents preferring face-to-face instruction and 20% preferring virtual instruction. As we know that our #1 goal for everybody is to eventually have everybody in a school building. So we've really been preparing hard for students phasing in. We've worked hard with child nutrition on the feeding plan. We've worked very closely with facilities to ensure that our district has the appropriate PPE and cleaning material, and that's all in place. We've been working with transportation to discuss our busing needs. We've worked extremely closely with our nurses just to develop written guidance for classroom staff and training, and really intensifying some of the mitigating measures that we already had in place in our self-contained classrooms. We've also talked with our staff. We talked to all the administrators, and our staff has been talking diligently with our families and determining how we can best phase students in a manner that is safe for our students and our faculty.
Mr. Dunn?
Mrs. Grant, I had a quick question. I guess with the EC children possibly being brought back into the building first and having to kind of juggle trying to do things remotely for their class, but also being handed plans for hopefully being able to implement that in the coming weeks. How have they managed that process in the time that they have to, I guess, not take away from what they are trying to offer remotely to the students currently, but also being able to prepare themselves, you know, in a fairly short turnaround as you look at this on a timeline?
Sure, that's a great question. Our staff wants their kids back, of course. Working with our self-contained children in a virtual environment, especially our children with autism, has been extremely difficult for them. And so they have been preparing for this. Ever since we left in March, our teachers have actually been preparing to have the children back in their classrooms. We have worked on this. We had several meetings during the summer with them. So we have actually been preparing for this return for pretty much since we got out in March, and really intensified through the summer, having several virtual lessons with them. They are finding it very difficult to being able to really reach children who, when we left last March, the children knew their teachers, they knew the routine. They weren't coming back, you know, they weren't coming back from a summer where they've had time away. And so this has been a year where often our students, they've moved into classrooms where they weren't familiar with their face. So it's been hard to build that bond and that relationship with that student through a computer means. And so they're doing whatever they can, knowing that Mr. Davis has worked extremely hard since we got out in March to get the PPE equipment, the cleaning materials in place. We've pretty much taken on all that and done all that for them. So really the only thing that we're looking at moving into next is phasing in some training with the nurses with them, and then the setup of the actual classrooms. Everything else is pretty much taken care of.
Thank you.
Sure.
So
Really, go ahead.
the next, okay, go ahead.
I was just going to say the metrics piece is now what we need to talk about. All I'm going to do is talk about the Scientific Medical Advisory Board, which is going to be meeting on Thursday. Those are the group of doctors from Duke that will start giving us just local information as metrics apply. We talked about that in closed session, so that'll start September 19th, I believe. So that'll be oncoming. So Dr. Catalano, do the NASH, some of the.
Excuse me, sir, I have a question I got dropped off for a moment, but I had a question I wanted to ask regarding the polling and the surveying of parents. Could I please?
Surveys, go ahead.
Okay, my question was regarding the polling and surveying done of the parents. And I'm looking at percentiles of 100%. Is that 100% of the parents actually surveyed, or is that the actual school population? Because see, that's the difference. If you survey 25 people and all 25 say this and only say this, it looks like, okay, 20% want this and 80% want this. But if you haven't reached the entire population, are we doing an apples to apples survey? That was my
Grant, did you hear the question?
Yes, I can answer that question.
question regarding.
It's delayed. I certainly can answer that question as far as the EC participation, and then Monique could jump in for the preschool percentages. For our percentages, it is for all children in our self-contained EC classrooms. So our teachers spoke with every parent within their classroom. Yes.
And Ms. Chavis, that is the same case with pre-K. Our numbers are so small right now. Teachers spoke with every parent, so they are included in that data.
Thank you. Good work. And y'all have done an excellent job. I wanted to applaud the effort of our teachers to adjust. Some are doing excellent. And I do ask that people on our side of the board be as patient with some of the parents and grandparents, because they're being challenged with not enough bandwidth, poor computer skills on their part, but they are really trying to help the students. Some parents that I've gotten calls from are saying that most of the teachers are very patient and they appreciate it, but those that aren't have to realize our students and our parents are our clients. Customer service is very important. And it's just as challenging for parents who have to work 8 hours. Are we actually recording some of the Zoom sessions or class sessions on Canvas?
We are.
Good. Thank you. That was my question. Thank you for allowing me.
Okay, so the next part of the presentation, as Dr. Ellis mentioned, we're going to walk you through some of the metrics that we have been looking at. But this slide just kind of captures what that looks like. Mr. Farrow and the nurses and I are in constant communication with both Nash and Edgecombe County Department of Health. They are providing us data directly as they release it to the public. They send it to us and we share that out. That includes weekly trends in the number of positive cases. Christy and Monique just talked with you about parent and guardian and staff comfort level. That is one thing that we're really conscious of of making sure that we answer questions and gauge that. And then just determining whether we're going to have adequate on-site supervision. So the number of staff that are requiring telework, the number of staff on COVID-19 leave that Ms. Privet shared with you, and then the availability of substitute teachers, which Ms. Privet is working through. Also, operational feasibility. Are the number of students that requiring bus transportation going to be manageable? Will the number of students choosing on-site learning versus virtual learning be manageable? And Danny shared some of that with you. So we're going to walk you through some other numbers as well right now. This is a graph that Nash County shares out most Mondays. And the red line that you see there is the cumulative total number of cases. But the line that we look at more closely is that blue line along the bottom, which depicts the weekly cases every week. And so you'll see that this one actually takes us up through the last week of August. And so this is the trend line for Nash County. And while Edgecombe County, Tremaine, if you go on to the next page, Edgecombe County doesn't collect and report their data in exactly the same way, but we did reach out to them and ask if they could provide a similar look at what Edgecombe County numbers look like. And so that gray line that you see there is the total case count. So that's the same line as the red line that we saw for Nash. And then the blue line down at the bottom is the number of cases by date. And so those aren't by week. They actually plotted it by day down there. But so those are the two kind of overall pieces of information. And Mr. Farrow is going to dig a little bit deeper into that with you.
So we spoke with Edgecombe County and we asked them if they had a positivity rate for the county. And the positivity rate is the number of people who go in to be tested within that county for COVID-19 versus the number who end up being positive. Edgecombe County did not have a positivity rate at this time. They did not have that data to give to us, but what they were able to give us is that they've had 1,023 positive cases. 37% of their cases were in Rocky Mount. Nash County Health Department shared with us that the positivity rate for Nash County is 9.6%. And in Nash County, there's been 1,730 positive cases. As you can see here, North Carolina positivity rate at this point is 13.6%.
Farrell,
Yes, sir.
on that slide, when you're showing the Edgecombe positivity rate, you're showing, is that Rocky Mount Edgecombe or Rocky Mount Edgecombe and Nash?
No, that's the where it says Edgecombe positivity rate is unavailable. All of that data under those two bullet points are for Edgecombe County. So just the part of Rocky Mount that represents Edgecombe County.
That's what I thought. Okay.
That's high. I have another question.
Yes, ma'am.
When we look at this 13.6% positivity rate,
Yes, ma'am.
is that the same rate that Dr. Cohen says they want to be 5% or less?
Yes, ma'am.
And it's almost triple. So, and another question, go back a minute. So the 37% in Rocky Mount only represents those cases in Edgecombe County, Rocky Mount.
Yes, ma'am.
So if we added the percentage of cases in Nash County, Rocky Mount. I wonder how much higher that percentage will be, would be, because we're not looking at apples to apples. We're looking at apples to oranges.
Mm-hmm.
And that would make a difference. Do you see what I'm saying? Because if you add Nash County percentages for Rocky Mount, that 37% is going to go up, I would think.
It wouldn't be
in fact, I'm almost sure. I know it would go up, but I wonder if it wouldn't go up substantially.
But Evelyn, they're not in Edgecombe County. I mean, why would it affect that percentage to be in Nash County of the positive cases in Edgecombe County?
Listen to me. I said, if the way it's looking now, we've got Edgecombe County, Rocky Mount at 37%. What is the percent? Nash County, Rocky Mount. That's what I'm looking for. And that's what we don't have. And that's the reason I said we are not comparing apples to apples. We're comparing apples to oranges.
Because you do have actual people in Rocky Mount that live in Nash County.
I'm one of them.
Ms. Bullock.
Yes.
What are you striving for here with that? We know it's going to be a high percentage, but what is it that you want out of that?
I want to draw our attention to that. I don't want it overlooked. Who is that, Dean?
Yes, ma'am, it's me.
It's information that we should have at hand. Don't ask me to compare apples to apples when I have information that is apples to oranges. I want the information to be consistent. This isn't.
Mrs. Bullock, this is the way that they presented the information to us.
I understand that. I understand that, and I'm not actually complaining about what you're presenting. I'm actually just pointing out, though, that I recognize that that information is missing.
The only difference that we see in this presentation, you see the positivity cases for Nash, you see the positivity case for Edgecombe. You do see the positivity rate for Nash County, but you don't see the positivity rate for Edgecombe. So right. If you look at what you're showing, we're showing that the positive cases for Nash is higher than Edgecombe. We don't have the information from Edgecombe to give the positivity rate. So
So what's that point?
Mr. Farah, first of all, thank you for getting this information for us. You can only report the information that you were given when you called up here, and I just think that ought to be known.
I made that point already, Mr. Jenkins. I'm not saying that there's something wrong with the information. I appreciate that this is what we've been given. I do. But what I am saying is that when we make a decision, we need information based on apples to apples, not apples to oranges. That's just my point. Nothing wrong with the information. I, Evelyn, need more. It's missing. It's not balanced. And I know the counties don't do things the same way. There are lots of things that they don't do the same way. I get that. But that does not stop me from wanting to see it.
So I do have some other information that's not on this chart, but I can just read it out. With Edgecombe County, they broke their data out into two specific areas. That was Rocky Mount and Tarboro. Tarboro had 40% of their cases. Rocky Mount had 37% of their cases. That part of Rocky Mount, which is in Edgecombe County. So 77% of their cases for Edgecombe County were between Tarboro and Rocky Mount. They shared with us that their age group 0 to 17 was 11% of their cases, and they are seeing an increase in positivity rates with that age group. 18 to 24 was 23%, and 25 to 39 was 38% of their cases. In the city, in Nash County, ages 21 to 30 was the highest. They didn't actually give us a percentage, but they said that was their highest infected group. 31 to 40 was their NAICS group. 41 to 50 was their NAICS. And 1 to 10-year-olds, they had 62 cases, and 11 to 18-year-olds had 188 cases. And both Edgecombe and Nash said that they are seeing, it included Boyce Willis, said that they are seeing an increase in the positive rates for young people. I'll move on to the next slide unless there are some other questions. Okay. So our school nurses and our principals, again, have been working hard, and others within our auxiliary buildings to try to keep up with when we have to exclude people, when people test positive. And so the information that we have, and we actually have it broken down by school and by central office and the other auxiliary buildings. But when we look at the cumulative numbers, we have 25 staff members who have tested positive, and I believe this is since August 10th. 56 have tested negative. If you add the two of those together, you have 81 who have tested that we are aware of. 47 have been in quarantine and are out, and we currently have 45 who are quarantined. What is not shown here is any of our staff members that's been hospitalized. To our knowledge, currently working, we had one staff member who was hospitalized, and that individual is currently out of the hospital now. I believe they were sent home yesterday. And of course, we have a staff member who passed away last week who had not worked since May.
Mr. Farrell.
Yes, ma'am.
The two numbers, 47 and 45, for quarantine and currently quarantined.
Yes, ma'am.
Come to 92. But we've only had 81 tests done. Is that what this is saying to me?
Yes, ma'am.
What about, I'm sorry.
I was going to say, I think I'll let you finish because I thought I knew what you were going to ask, but I'll let you finish to make sure.
I was going to ask where the others that are quarantined or have been quarantined, do we not add those two together?
So in some cases, what has happened, Ms. Bullock, is an individual may come in and especially this was early on, and they were not, maybe they were not feeling well that day, and they went home. And what the nurse said to them, you go home, you had a fever today, you go home. If you're fever free for, I think it's 24, 48 hours, something of that nature, without taking any medication, then you can return to school. And so we've had those situations where those individuals may have been sent home to what we call quarantine or self-quarantine and self-examine their symptoms, but there was not a need for them to go and be tested because the headache or the fever or whatever it was resolved within a certain time frame.
Mr. Farrow, we also have some that are awaiting test results, do we not?
Yes, but they are in that group that are currently quarantined.
Right. So that would account for the lack of a test in the count.
Thank you, Dr. Catalano.
Yeah.
Are there any questions for me on those two slides? Thank you.
So the final slide is going to be basically a recommendation. So when we wrote the plan out, we said after the end of these 20 days, we were going to meet again and decide if we were going to bring back the pre-K and special needs populations or self-contained. So what the school day would look like, well, you can have the 2 weeks is going to be to prepare for all this for us to compile with transportation based on your decision tonight. So if you were to say we're going to move with Plan B with pre-K, special needs, then we would start September 21st, which will give us 2 weeks to get this in place. The school day, 8:15 to 12 in person. Of course, reduced number of students. We talked about the 4-day a week with the Wednesdays, be the cleanings. The afternoon remote would be the pre-K piece. They'll get half a day. Then the other, I think it's 2 hours of instruction they would get remotely. Masks are required, students and staff, unless an exception is met based on one of those criteria. The Plan B, track 1, track 2 that we talked about, less density in the building. So if we did this, September 21st would be the first group, self-contained and pre-K. Then I think we would start October 19th, deciding if we wanted to bring in K3, because that would give us another few weeks to get transportation piece cleaned up, find out how many parents want to stay virtual, find out how many teachers are going to be teaching virtual, teleworking, all that has to be planned. So we would think that the timeline for a K3 decision would start October 19th, where we could start. And then you would run out to January, where Plan B, you would go ahead and start grades 4 through 13, which would be early college and things of that nature. The concern about secondary, in my opinion, would be we have a very short semester, which means we have December when our semester ends instead of the January where it used to be. So we have less days first semester, more days second semester. So tonight it would, this is for you to vote on to see if you want to start Plan B with pre-K special needs population starting on that 21st. Mr. G.
Dr. Ellis, I would like to see maybe the October date for the K3, if we could bump that up. And what is your opinion on possibly getting these middle school and high school students back before the end of the semester so that they can, I guess, get some refreshers and reference to exams coming up, stuff like that?
You know, I think if we start Plan B and you see, the pre-K piece, I think depending on what the teachers want to do will probably drive a lot of this. So if we feel like we do those surveys again and principals can determine if they're going to have more virtual, some telework, that's going to dictate, I think, a lot of this. I mean, the sooner we get that information, if you want us to move forward as a board, I can find that information and bring it back. If you feel like we need to start early, modify that, that's the pleasure of the board.
I would like for us to reach out, as Ms. Grant did, to the parents to see how many we're gonna have wanting to come back and how many we'd like to. That's definitely says I'm gonna continue with virtual learning. And
Mr. Chair.
Can I ask one more question? Have you been able? I know you've been busy. Have you been able to go to any of these counties that's had that went straight to Plan B, and what have you seen, and can you tell the board?
So I went to Greene County last week. Probably a smaller district, but I just wanted to see what a Plan B would look like. The way their numbers worked, they had a third that were virtual, which means they would only have on track a third in their building. So there was no class larger than 6. Transportation, I did not see a lot of people riding a bus. I stayed for the elementary, the high school and middle school opening because they share buses like we do. It seems like a lot of parents wanted to drive their kids to school. So I think that would be, to answer your question, Mr. Jenkins, is something we need to make sure we ask, are you going to ride a bus? To me, that is the hardest piece right now to manage is transportation because of the temperature checks, the attestation forms, all that has to be done. Where if you limit the amount on buses, you're going to stop some of that and you can probably get some kids in school. Their high schools in a Plan B, they probably had about 50% in their high schools virtual, which is kind of interesting. But they were allowed to, they had to stay virtual for the semester. So it's a little different. They have, I call it concrete numbers, which is what you probably need to stay with. You don't need people coming in and out. If we're going to do it, you need to make sure we stick with a number. But I think what my only concern about Greene County, and I asked the superintendent, if a kid tests positive, what happens? Do you shut the whole school down? Do you shut everything down? And their health department gave us basically the same guidance that Mr. Farrow did tonight, based on certain parameters in the classroom. Was a mask worn? Were they 6 feet apart? Determines whether they just send a kid home, send a class home, or shut a school down. The school shutting down involves the cluster that Mr. Farrow talked about. So I know that Pitt County is in Plan B. I've got a group of principals I want to take possibly next week to Greene or Pitt just to kind of look and see what it's like. Because I think we're going to need some of that optics to kind of see, because it is different to see only a third of your kids in a building. I mean, it's just different. But I think they need to get a shot of looking at something like that so that when they can come back to the building, kind of, I know when I went, it helped me inside internalize what it would look like. Because they were only doing instruction to about 1 o'clock. And then from 1 to about 3, they did some sort of a virtual planning time where they could reach out to those virtual learners, because that seemed to work for them. And they're now going to have a cleaning day, but I think theirs are going to be on like Mondays or Friday. So they're implementing that too. So, yeah.
Mr. Chair.
Yes, ma'am.
Can I ask Mr. Farrow to go back, please, to the slide that showed the positivity rate?
Yes, ma'am.
Thank you. That's it. That's it. if we just look at the positivity rate in Nash County, that's 9.6. Is that correct?
Yes, ma'am.
We don't have it for Edgecombe, Rocky Mount.
That's correct.
The positivity rate for the state is 13.6. Our scientists, particularly Dr. Cohen, says, I think every time I've heard an update, that she is looking for our positivity rate as a state to be 5% or less. With just one part of our county where the majority of our kids are, we are already almost double the recommended rate. I don't, in good conscience, see how we would want to put our children in such a situation right now. I would prefer it if we would just put this on hold and look at this on the 21st of September or somewhere thereabout to see if the numbers are better. Because I don't want to be responsible for sending our kids back in an atmosphere, in an environment, that's the better word, in an environment that we know up front is probably not safe. I think that's unfair to the children. We're making decisions for children who can't speak for themselves. And I have empathy for the parents who, for whatever the reason, wants to send his kid back to school. But for me, the possible cost is too great. I would not be in favor of sending any of our kids back to school now. I would be more favorable to look at this again in September and look at the data and let the data drive our decision, not convenience.
I have a question, and I know it's the hardest one probably for me personally to ask, and I look at the percentage of our positive cases. How are the death numbers looking? Because we do realize that there are people, well, one right in our system, but let's say in our community at large. Nash County, do you know the death numbers for Nash County by chance?
Give me just 1 minute and I can pull it up, okay?
I'm sorry.
And
I hate asking on the spot questions.
In Edgecombe County, they are reporting, I think it's 24 deaths as of today.
Mm-hmm.
And just a minute, try to pull up. I'm sorry, bear with me, please. And in Edgecombe, 28. Excuse me, Nash County, 28.
Okay. Thank you.
You're welcome.
Hey, Mr. Jenkins?
Just to follow up, and to correct me if I'm wrong, Dr. Ellis, I don't think we're requiring them to come back to school. I think they have a choice if they can like to continue to virtual learn that they can. Is that correct?
That's where, and that's where I want, when you think about every one of those parents was contacted, just remember they get an option to opt out. And I think with Plan B and even when we go into A, they're going to be given that option. That's why I'm proud of my team for calling those parents, because that's the decision they're going to have to make. So they have to decide that. That's why we want to reach out to all those parents and make sure they were comfortable with what we were trying to do.
Dr. Ellis, may I ask one question? Are we to be reassured as a board that parents who do decide not to allow their kids to come back, they will not be penalized, they will still be addressed and respected as a student, given every opportunity to communicate with the teacher, to go through the proper or change of the curriculum itself?
They will be provided an option for learning just as if they were in school. Whether it be recordings, like pre-K is going to be half a day, so there's going to be some remote instruction that all of those kids will receive. So, but that option, they're going to have the same instruction. One's going to be remote, one will be in person.
Sharp. Three things. First of all, can we go back to slide 19? Please. So what we're looking at is 106 possible students for pre-K. And then EC students. And then if we go to slide 27, slide 27 is the participation of the survey that you did. From what I'm understanding, 80% of these parents want to put their kids back in school.
Thank you, Mr. Shaw.
20% does not. So if those 20% who does not, they still have the option of doing virtual learning.
Both will get the option though.
Right, but just if
those
you're looking at there's pre-K is a little bit, I mean, it was like 78 to.
Whichever slide it was, I don't know which one it was. I think it's the next slide. Oh, I don't know. That's middle school, high school. So 82%. The other thing is, Mr. McQueen, you talked about not having enough devices to mandate for those elementary school kids. If we have kids in school, that would free us up opportunities to give devices to those remote kids that do not want to, parents don't want to put them in school. Correct me if I'm wrong.
They may still
I'm
be.
hoping I understand the question. I think you were saying if.
Let me just say it again. Yes. You stated in your presentation that actually we have 11,604 laptops that we have that distribute out through the district. The grades that are suffering because of lack of laptops are the pre-K, first, second, third, I think second, third grade.
Pre-K through first.
Pre-K through first.
Yes.
So if we allow those 80% to come back in school, that'll free up some opportunities to give us laptops for the 20, whatever that is, 18% that don't want to do virtual learning.
I think I understand where you're coming from, but even if they were in or out, I think they will still require a device.
Mm-hmm.
So,
yeah, and here's what I'm saying. At the inside, everyone that don't necessarily have to have a device because you got a classroom that they can, well, not share, but the teacher there's a visual presentation for the whole class.
I can see that, but I can't speak on a classroom.
I'm just putting it out there.
If K1 was to do that, right? If K1, the pre-K will need a device for that afternoon session of whatever.
Mm-hmm.
Any other questions? Mr. Jenkins.
I promise this is the last one. As you can see, I want to get kids back in school as soon as possible. But I see the virtual learning, and that's the hand we're dealt. Has anybody in, I think it was Miss Dancy Smith's presentation, sat in on any of these virtual classes? And if so, what classes have you sat in on?
I have sat in on Guilford County, but not ours.
was that?
Donna.
Oh,
I
this
didn't have a
directed to
chance, and
central
I was-
office staff.
Oh, I'm talking about as a parent or grandparent, and as board members, we need to look at some of this as well. There are some that were, the ladies that I watched, some were like excellent. First and second grade, you would have thought it was a national television educational show like Sesame Street or one of the high-end learning programs. Excellent, engaging. But others were very weak. The material was not at grade level, and it was not engaging. And I think the teachers and their talents have a lot to do with that. So it could be very, very good, and then it could be poor.
In the slide that Chad showed in the next 20 days, that is when we start pushing in to these classrooms to see what's going on. Because right now, principals have access to go in any one of these classrooms with an invite and push in and see a classroom, like I'm sure like Mr. Evans does.
I understand that. I'm wondering at the central office, how many classrooms have you sat in on or anything, the ones that presented that information?
Jenkins, I can answer that question. I have not sat in classrooms for an extended amount of time, but during the first week of school, everyone on the elementary team went out to schools, and we did not engage in observations, but we made sure we were there to support teachers. It's ironic that you asked that question, because right now our teachers feel very uncomfortable with us observing them. But just yesterday, I contacted Michelle Griffin and asked her to share with me some names of teachers who would feel comfortable right now with us going into their classrooms and being a part of their Zoom lesson. So there are about 4 teachers next week that I plan to visit, be a part of their virtual classroom.
Mr. Jenkins, this is Chad Thompson. Same with secondary. We have visited, we went out to many schools, all our secondary schools within the first week. We have been supporting teachers and giving them this time to really get focused and used to this. In the next 20-day slide, we specifically put in that C&I team will be doing virtual walkthroughs where we will go into classes. And that, once again, is not a gotcha, but it is to support the teachers and to help them move forward in this time, because we have realized that we have teachers at different levels and we want to be supportive at different levels. And so we feel like we had a system of doing this. I can tell you that our administrators have been in the classrooms and have sat in Zoom classes. I've talked to some of those. And so I feel like we are now moving into those next days where we can really engulf in that kind of observation.
Mr. Jenkins, this is Ms. Grant. I have sat in a classroom and watched teachers from their perspective do the classes. For instance, I was at one at a high school and it was awesome. The teacher had her computer facing the board and was up teaching just as she was teaching, and the children were arguing on the computer in the classes just like as if they were in the classrooms, in some productive struggle. It was great. I've got a program specialist who oversees curriculum, and she has been in and out of the classrooms, and we have varying levels. Some of the teachers have asked her to come in and support them in their virtual instruction, and others we've just gone in, and it's been wonderful. I mean, we've seen some really good things.
And Mr. Jenkins, just to add to this, during this time, having relationships with principals and having relationships with teachers, really, it's critically important that they have that relationship with central office, so they can see that when we come in, just like Mr. Thompson said, it is to support them, and it's not a got you, but because they're still struggling themselves, we really have to be very careful regarding how quickly we jump in to want to be a part of their virtual classrooms. It's a teacher comfort level. but also a student comfort level as well.
All right, thank you.
Any other questions?
I've been to
I
20.
just want to make one more comment, Mr. Chair,
Go ahead, Ms. Bullock.
and that's to, I don't know who made the comment, but I would just like to say, I understand the 82 versus 18% percentages, but we are on this board to make decisions that would be best for all of our kids, not just the vocal majority. And I think we need to make sure that we consider the silent minority as we make this decision.
I have a question, Mr. Chair.
Go ahead, Ms. Chavis.
From a legal standpoint, if we should go in and allow this, what are the consequences to the school system or the board if, for example, a student does get in contact with someone, gets COVID-19, goes home, gives it to a parent or whatever, and there's a death in that family? To what point are we liable?
Mr. Malone.
I can't hear.
That would be a closed session.
Okay. All right. Thank you.
You know,
But there is some immunity. I think there is.
Folks, I've sat here and listened and to other board members and all, and I agree with most of you. But you know, we've had, like Ms. Bullock said, 82% of the parents said they'd like to have the child back in school. But we have given the parents still had the final option. I think we're at the point now we need to support our administration and get the kids back in school, because some of these same kids are the 82% or the 18% are the ones that are at Walmart and other places. And the parents have stated, because we've done a survey, we've polled our constituents, and they want, majority of them want their kids back in school. I think as a school board, we should give them the option to do that.
Can I piggyback on that, Mr. Lamb? Again, let me just reemphasize the point that, Dr. Ellis, would you raise your hands, please, so we know who you are? We hired that man as a superintendent to actually work through the system for us and bring recommendations to us. So the recommendation that he's bringing, he did his due diligence, I'm assuming, with all your staff. He went through all the things. And so the recommendations, I concur
You
with what you're
willing to
saying.
make a motion?
Yeah, is it the time for it now?
Yes. Past time.
Well, Mr. Chair, I move that we move upon the recommendation of the superintendent and staff.
Motion by Mr. Sharp, second by Mr. Bissett. We'll do a roll call vote. All in favor of going with the administrative guidance and procedure? Ms. Chavis?
No.
No.
Hey, Mr. Edwards?
Yes.
Yes, for me. Mr. Bissett?
Yes.
Mr. Sharp?
Yes.
Mr. Dunton? Mr. Jenkins?
Obviously, I'm not gonna get my October 5th, so yes.
Mr. Silver? Mr. Silver? Ms. Washington?
No.
Ms. Hines Bullock?
No.
Ms. S. Bullock? We have 6 yeses and 4. Mr. Silver?
Yes. Do you hear me?
Yes, sir. How do you vote
My
on?
vote.
Sir?
My vote was no. I thought
Okay.
you heard me. I'm sorry.
Vote passes 6-5.
What was Ms. S. Bullock's vote?
No,
Again, we go back, we hired a superintendent.
I'm sorry,
Said no.
he said something else.
Mhm.
okay, we're down to, any other discussion? We're down to Mr. David Facilities Custodial Settlement Agreement.
Evening. The Nash Board of Education approved the termination of the custodial contract effective 8/31/2020. Through negotiations, Beck agreed to credit the August invoice $125,000, release Mr. Derek Brown from his non-compete clause, and make a final materials order. The remaining depreciation for the equipment in the amount of $260,000, $735.93 will be paid per the contract. Fiscal implications: the credit will remain in the operations account for custodial staff. Depreciation costs will be funded from the unallocated capital outlay fund balance. Superintendent recommends the board approve the settlement as presented.
I'll entertain a motion to approve the.
So moved.
Second.
Motion by who?
Chavis.
Motion by Ms. Chavis, second by Mr. Sharp.
That was capital outlay. I don't think it's capital outlay.
Mhm.
Yeah,
We have a motion, we have a second, we have a vote. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
yes. Mr. Busy, Mr. Sharp, yes. Mr. Dunn,
Yes.
Mr. Jenkins,
Yes.
Mr. Silver,
Yes.
Ms. Washington,
Yes.
Ms. Hines Bullock,
Yes,
Ms. S. Bullock. Motion passed. Now we're down to the superintendent's report.
so I just want the board to know that we're gonna move forward Plan B. If there are issues and metrics that cause us to meet again, I will meet again and we'll talk about what we look like. But I'll meet with principals tomorrow and we're gonna discuss moving into Plan B, pre-K, special population.
and what date would that be now?
That would be September 21st.
Would that be just for kindergartners and EC students?
It would be just for pre-K
Pre-K.
and self-contained, exceptional students.
Thank you.
All right. So I just want everybody to know this is a new experience for all of us. I've been to 26 schools in 2 weeks. And I just want to thank teachers for showing up because it is so important that they're the first step in us getting to a little bit of normalcy back in the school system and these schools for these kids. I was in Inglewood the other day where we were celebrating the 60th anniversary, and to see teachers out there excited, and it's a first step that I think that we need to take. So thank you, teachers, for this new experience, but thank you for showing up. Principals, thank you for your leadership. This is a new environment. I know there was no class in grad school on this. Thank you for your dedication and support. Looking forward to meeting with you tomorrow about how we move forward. Parents, I appreciate your patience. Everything has not been perfect, but please work with us. We're trying to figure this out. I know you didn't sign up for this either, but we're trying our best to make sure we put the needs of your student first. I do want to give a shout out to the technology department. When you look at numbers of 11,604 Chromebooks in a 4 or 5 months time, that is a lot of stuff. And Tremaine will be the first one to tell you that we have not been perfect, but I appreciate that technology department because fielding 1,500 calls, hotspots, Wi-Fi, we're getting better every day, and I appreciate it. And I want to give a shout out to those technology department. And Ms. Bullock, welcome to the school board. Look forward to working with you and getting to know you better. Thank you.
CARES report, I've got a few bullet points on the new elementary school update that was shared with me from Mr. Davis. The project is still on schedule. Design development phase was completed on August 28th. Preliminary numbers are showing the school is still within the budget at this time. And there will be a more detailed presentation at the October board meeting. That's all I have for that. And again, Ms. Bullock, welcome to our school board. Schedule upcoming events. October work session will be Monday, October 5th at 5 p.m. Regular board meeting will be October 5th at 6 p.m. At this time, we will go back into closed session.
Need a motion?
Right, just personnel.
So moved.
I thought we would. We had a motion by Mr. Jenkins, second by Mr. Edwards. We're gonna go to the roll call again. Ms. Chavis,
Yes.
Mr. Edwards.
Yes.
Yes. Mr. Busy, Mr. Sharp. Yes. Mr. Dunton.
Yes.
Mr. Jenkins. Yes. Mr. Silver.
Yes, sir.
Ms. Washington.
Yes.
Ms. Hines Bullock.
Yeah, but I didn't hear a motion.
There was a motion, there was a second.
Maybe
Motion by Mr.
Jenkins.
Jenkins, second by Mr. Edwards. Ms. S. Bullock. Motion carried. We are now in closed session.
Hold on, make sure we keep everybody out.
Mr. Chair. Hello.